all patients should have a triple lumen catheter placed inside to drain the bladder. And this catheter, you can pass the catheter just like that. It may be fine. It goes urethra, prostatic fossa into bladder. But in some patients where you cut deep at the bladder neck, in some patients where you think you've done deep resection at the bladder neck, use this device which is called catheter introducer. You have to put this in and fix the catheter in this introducer like this and hold it here. Put some jelly. So this catheter introducer will not let this tip or the Foley get stuck to the bladder neck. Some jelly on this catheter, and then you hold it straight, and the way you pass the dilator, you pass this catheter. When you come in the area of bladder neck, just tilt it. It will automatically go without hurting the bladder neck. So this I find is a safe device to place the catheter. Inflate the balloon to how much? This will depend upon the size of prostatic tissue you have, size of the prostate that you have handled. If you resected 15-20 grams like here, use only 20-30 cc, not much. I don't think we need to do here balloon tamponade. So I am not planning to inflate the bladder balloon too much. And when you take it out, also follow the curve again, like this. At the end of the operation, never forget the glue should be reposited back all the time. See the bleeding by the side of it? No. Look at the flow. Look at the color of irrigant, connect the continuous irrigation, and look at the outflow. You should also use, just close it for a while, let the bladder fill up. You must always wash the bladder and this catheter with a 2mm syringe. By chance, if you left in a small chip or a blood clot, the 2mm will flush it. Now this is a 2mm syringe. Push it in and take it out. The small piece of clot will always come out. Look again. Push it in and push it out. Do it 2-3 times. Do it 2-3 times at the end of operation. It's all clear, so we are fine with it. Fine with it, yeah, you're fine with it. Connect it to the bag and see the outflow. This is the color of the fluid that's coming out. This is quite acceptable color at the end of the section. So we are done with it. Okay. This patient will remain on continuous saline irrigation for about 4 hours, and you will see what happens. This is the color of the fluid that's coming out. So this is the kind of color that's coming out. Okay.